Hello, my name is Dr. Olufikayo Babitele. I'm a research fellow at the Holyoke Medical School, and I'm really excited to introduce this PhD opportunity, which is funded by the Vice Chancellor's Research Scholarship at the University of Hull, and is looking to develop an intervention to promote spousal communication among Black men with prostate cancer and their partners. So in terms of the research itself, so we know that prostate cancer affects 1 in 4 Black men, compared with 1 in 8 whites and 1 in 13 Asian men. After treatment, men often experience complications like sexual dysfunction, erectile continence, fatigue, which not only affects their psychosocial well-being, but that of their partners as well. However, evidence shows the couples often find it difficult to discuss the side effects and to navigate together, this complications post-treatment. Ethnic inequality exists, though, in terms of psychosocial support that is available for men and their partners to navigate this challenging area. And in particular, Black men and their partners are underrepresented in research in this area. That is where this PhD comes in, to address this gap in the evidence base. And it will be looking to develop and test a psychosocial intervention to promote spousal communication for mutual problem solving among Black men diagnosed with prostate cancer and their partners in the United Kingdom. In terms of its impact, this PhD has the potential to drive equity in cancer care and research. It's going to make new, significant, and original contribution to knowledge, as this will be the first in the UK to address this particular problem. And more importantly, it's going to be improving health outcomes for an underserved group. In terms of the supervisory team, so I will be leading the supervisory team. I'm a research fellow. My broad area of research is cancer inequalities, with predominant focus in the psychosocial aspects of prostate cancer research in Black men and their partners. So I've got the subject expertise, I've got the links and the networks with this particular population. And I'll not be doing this journey alone. I'll also be supported, as well as the PhD candidate will be supported, from the expertise of Professor Liz Walker, who is a professor of health and social work research, as well as Dr. Maureen Tweedy, who is a senior lecturer in mixed methods research. So we've got a competent, experienced team that will be able to support the PhD candidate. This research will be conducted at the University of Hull, and the candidate will be based at the Holyoke Medical School and also at the Institute of Clinical and Applied Health Research at the Faculty of Health Sciences. Under the supervision of an experienced team, you have access, to a workspace at the Postgraduate Research Office in the state-of-the-art Alam Medical Building with excellent modern facilities, as well as a collegiate environment with other PhD students. You have access to internal and external training opportunities, as well as professional and personal development opportunities. In terms of those development opportunities, so the candidate will benefit from interdisciplinary and multidisciplinary collaborations with internal and external colleagues, for example, NHS colleagues, clinicians, charity organizations. You'll be able to engage with these organizations. Also, there will be opportunities to network, to do knowledge exchange activities through conference attendance and presentations, as well as engage with the patient and public in this underserved research area to be able to develop together with them this communication tool. Post-PhD, there are a lot of exciting career opportunities. You could stay in academia as a researcher, as a lecturer, or you could decide to go into the industry. You could work in policy development units. You could also go into the NHS, whether to do research or into leadership. Also, there are a lot of cancer charities as well that will benefit from the expertise, of a researcher. So there are opportunities there to also explore within the charity sector. You could decide to be a consultant using the knowledge, the expertise, and the experience you gain during the PhD journey, to be able to provide that expert advice to organizations that will benefit from such. Or you could decide to work in the public sector. So there are a lot of exciting career opportunities post-PhD. How do I apply? So for you to apply, just visit the University of Hull website, the Postgraduate Research site, and you will see a link to this particular PhD. Click on it and then follow the instructions. You see all the necessary information regarding the entry requirements, how to apply, how to write your personal statement, the closing date, which is the 15th of February 2024. And perhaps if you still have any question that you'd like to ask us, an area you'd like to clarify, please reach out to me. You can contact me via email at olufikayo.babitele@aims.ac.uk. I look forward to receiving exciting applications and to working with the ideal candidates in due course. Thank you for listening.